Bonjour and welcome all to the Société Santé en français webinars. I am Nathalie Boivin, Knowledge Broker Officer at the Société Santé en français. It will be a pleasure to be your host for this webinar entitled The Carrefour de l'offre active, an active offer hub to discover. I would like to begin by acknowledging that the land where I am is the traditional unceded territory of the Maliseet and Mi'kmaq peoples. This territory is covered by the treaties of peace and friendship, which Maliseet and Mi'kmaq peoples first signed with the British Crown in 1725. I'm grateful to the Maliseet and Mi'kmaq peoples for their hospitality on these unceded land. A few words on Société Santé en français. Société Santé en français is a national group of 16 provincial, territorial, and regional networks that are committed to improving the health of all Francophones and Acadians living in minority communities in Canada through greater access, quality health care services in their language. The webinar follows three objectives: improve access to new information, facilitate evidence-based decision-making, and foster interaction between information providers and users. The webinars are made possible thanks to the financial contribution of Health Canada. Our panelist today is Mrs. Elisa Micheline-Beaulieu. Elisa Micheline-Beaulieu is Project Manager at the National Secretariat of Consortium National de Formation en Santé. Elisa Micheline has over 20 years of experience working with Francophone minority communities. Since her arrival at the Consortium National de Formation en Santé 4 years ago, Elisa Micheline has been involved in training in the active offer of health services in French. Originally from Northern Ontario, she herself experienced language barriers in accessing health care in French. I would like to cover a few items of logistics to let you know that you are all in mute at this time, but we want to hear from you. There are different ways for you to participate and interact throughout this webinar. During the presentation, you can do so in writing by using the chat box or Q&A boxes that are at the bottom of your screen. There will also be a few polls. They are anonymous and optional, but we strongly encourage you to participate. And talking about poll, let's see a first question just to get started with the polls. So there's the question. What motivated your participation in today's webinar? There's a single choice only for you to choose. Was it a general curiosity about a topic? Was it a desire to discover new tools? Was it the opportunity to improve your competencies? Or was it another motivation? If so, please use a chat box to provide us with the details. Once this is done, press submit. As soon as 70% of you have voted, we will display the result of the poll. Meanwhile, I'll let you know that there are quite a few of you today, and you are either from Nunavut, Manitoba, Ontario, Quebec, and New Brunswick, and we're all very happy to welcome you. As well, there is a participant from the USA. So for the majority of you, 45%, it was the opportunity to improve your competencies. Wow, this is right on. 18% was either a general curiosity, a desire to discover new tools, or other. So thank you very much for participating in that first poll. As well, I would like to let you know that during the discussion session, you can interact with us by either raising your hand or again using the chat box at the bottom of your screen. And I will invite our guest speaker today, Mrs. Elisa Micheline-Beaulieu, to proceed with our presentation. Elisa?
Merci Nathalie. Good morning for some of you and good afternoon for everyone else. Canada is a big country, so we're never at the same time. Sorry. Okay, here we go. So today I will be presenting the Carrefour de l'offre active. And thank you for your interest in the active offer and into discovering or knowing more about this tool, the Carrefour de l'offre active. L'offre active, which today I'm calling the Active Offer Hub. We did not give an English name to our website. So Carrefour means crossroads or intersection. In French, it's the word we use for a roundabout, a place where there is a lot of action, a lot of people moving forward, and hopefully in a safe way. And then I looked up the definition for hub, and I found a synonym like center, center point, and nerve center. I thought it seemed to be talking about the same thing, a place where there is a lot of action, and it's about meeting and moving forward. This is what I think what we're trying to do with the Carrefour, is keep it as a very dynamic website. So yes, this is what we're hoping it is now, and will become even more so with time. Sorry. Of course, the first aim of the Carrefour is for the training of future health professionals, but it has as well evolved in being a little bit more than that. So I will take you through the Carrefour, and especially today we'll be looking at the English content, okay? I just want to make sure I don't miss anything. Sometimes I tend to speak too fast. I'm going to try to slow down today, okay? The Carrefour was launched over a year ago, almost 2 years now. And this year, we will be conducting an evaluation of the website. We want to know if it is used and if it serves the purposes we had intended. How is it used? What are people looking at? And what is missing, or what you would like to see? So there will be a survey shared soon on our social media. So I do invite you to respond and help us improve the Carrefour. Don't hesitate, please, to add comments throughout the presentation, ask questions. I really want this to be an interactive, so don't hesitate to ask for clarification. Tell me to slow down or to see something again, or to go back. So please feel very free. You can as well ask your questions in French. I will answer in English, since this is an English presentation, but if you're more at ease with asking your question in French, no problem. I will translate your question and answer in English, okay? I will move on to my next slide. The Carrefour replaces what was formerly the Active Offer Toolbox. I don't know if you were familiar with the Toolbox, but it was launched quite a while ago. Professors Pierre Bouchard and Sylvain Vizina, as well as the research assistant Manon Cormier from the Le GRIOSS, the research group from the University of Moncton, Université de Moncton, were pioneers in the production and dissemination of knowledge on the active offer of French health services. In 2008, they took on the mandate to raise awareness and mobilize the players concerned with the active offer. That is within the Consortium National de Formation en Santé. They also defined the basis of an action strategy, at the center of which was the design of a toolbox for the training on active offer of future and current health professionals. if you want to maybe raise your hand or let me know if you knew or have used the boîte à outils pour l'offre active in the past years.
So far, the numbers are climbing. I've had 3 people raise their hand saying that they've seen the Carrefour. Yes.
Okay. Okay. Sorry. So from 2000, the boîte à outils was launched in 2013. So there was quite a few years before that of connecting with the people, consulting, talking with students, teachers, professionals, before eventually creating the boîte à outils, it was launched in 2013. With a variety of content in various forms, thematic sheets, case studies, training material, and also many video clips, which I think they were really the core. They were used a lot. And these clips are still part of the Carrefour, because even though they're about 10 years old, they are still very relevant. It's almost sad to think that they are, because are we still having so many issues in accessing French language services? But they are worth watching and learning from. Okay, so the Carrefour de l'offre active, or this active offer hub, is a new platform to catch up with technology. The boîte à outils, when we were thinking of updating, the platform itself could not be updated. So we did have a firm create a new platform. There is new content based on recent studies, but it does not mean that we just got rid of all the content from the boîte à outils. We looked at that, we updated, we rephrased, but a lot of that material was still very appropriate. We did look into it. There's new resources, videos, so we will look at that. Okay. And so I will take you into the Carrefour. Yes, the website is French, but the whole content has been translated and is in the 4th tab taking part. So we will go into the Carrefour. Any questions, comments up until now? Anything you would like clarifications or anything before we actually go in and see the Carrefour? When you enter as you come to the landing page of Le Carrefour de l'offre active, this is where you land. This is where you arrive. You'll see, as you realize, the colors, the look and feel has changed a lot from La Boîte à Outils. We wanted to be a little bit more, not as colorful, not as dark. Not that dark may not be, it sounds like a negative term, but we wanted to be a little bit more dénudé, a little bit more. So this is the landing page. And as you come here, you have access to like 4 different entry. You can enter into understanding, teaching, participate, and the English tab taking part. You also have information in the apropos. You will learn, people will learn a little bit more about what is the Consortium de Formation en Santé and how we came to, from de la boîte à outils, we came to Le Carrefour de l'offre active. There's a little bit of information here on every tab, and les remerciements to our, we had a national group of people to help us create Le Carrefour, and we do acknowledge their participation in helping to create the Carrefour de l'offre active. Okay, and I want to show you as here there is a note from le GRIOSS, who created the first boîte à outils, on how they created it was really a big research project. It was a very intense, long discussion going across Canada to meet people to set up this strategy of training our students to the active offer of French services, French health services. Before we go to the English content, I will show you what is there in French and how we and why we created it this way. So the first tab, comprendre, understanding, contains all the information. It has all access to all the themes, all the resources, and all the thematic sheets. This tab can be used for self-learning. It can be used like for maybe for teachers who want to be more at ease with the active offer before they start creating lessons. So this, and maybe you recognize Jacinthe Savard here. It was a video taken at the colloque de l'offre active at la Cité universitaire francophone in 2019, I believe. Sorry. So I can access all the themes here. Language, active offer. So we have 6 different themes. We may be adding more themes as the Carrefour grows. I could go back to comprendre. All the resources. Resources can be searched either by keywords, format, video, document, or subject. We've divided the resources in different subjects. And then the thematic sheets. All of them are, you can access all, and these are all in French, but I will show you that they are all in English as well. So this is the patient-centered approach, and it's a sheet. They are printable. They can be downloaded. There's this is really to be used. There's no, of course, if they are used, we won't. It's good to acknowledge where you've taken the material, but feel free to use the sheets to teach, to learn about active offer. Now, the second tab is teaching, because the Carrefour de l'offre active, or our active offer hub, is really aiming at training our students all in our French health programs. The CNFS, the consortium, is really engaged towards training towards active offer. We realized that only training people in French in health fields was not enough to bring them to actually really offer the services in French. They weren't always conscious of how important it is. So we introduced the training of active offer in the different programs. So this tab contains a teaching material. So we have all the case studies, and I have to say right now, this is not translated yet, the case studies, but we did have requests to have it in English, so they will be translated. So as well, the thematic sheets, as well as the case studies, are as well available in, so the teachers, trainers, or anybody can print it or download it as a booklet, so that you have everything is available in one spot. Teachers have access to, of course, the themes. Resources here are only aimed at teaching. So we've put together some of the resources most useful for teaching the active offer. And then all, of course, teachers have access as well to all thematic sheets. So we've divided, between understanding and teaching. The content can be similar, but teaching should be easier for teachers to find the material. Any question? Everything okay? The tab participate. Participate is aimed, of course, at health professionals or managers of health institutions. Though the website is for the training of active offer for our students, it's also training of health professionals already in place to help them understand the need and also how they can help to make French services more accessible, and also how to work with stagiaires, wow, I don't know that word in English, work placement, students from health programs, when they welcome them as for work placement, so that they understand why this student may want to offer services in French. So it's really still about training, both for our students so that they are better understood in their workplace, and for just general information about helping to have access to French services. Hope I'm clear. Now I get to taking part, and this is where I hope you will help us improve. This year, we really want to improve the English content. So far, everything has been translated and is on this tab. What we're doing now, though, is now we're adapting the content to be more specifically talking to our Anglophone colleagues, friends, professionals, so that they know what they can do, even if they don't speak French, to help patients access French services. So the content has been changed in all landing pages. It's not there yet because we want to learn to wait till after we've done the surveys. We've prepared content, but before changing the website, we want to make sure we get all the comments from our users. Because the content that is there now was translated from the French, and it does need to be adapted now to really addressing Anglophone community professionals. So all the themes are there. Same themes. Resources in English, and we are still adding new resources. And thematic sheets, everything has been translated here again. So you can have access to all the information on the different elements in the active offer, social determinants of health, patient-centered approach, everything that is around, because active offer, as we know now, is not only saying hello, bonjour, there's so much more behind that. That people need to be aware of to understand why it's important to make French services available and seen, because sometimes Francophone are just not aware that they exist and will not ask for them. So this active offer is about making sure people are aware that they can ask for services in French.
Hey, Lisa.
Oui.
May I interrupt? Just I have a question.
Oui.
I see that there are a lot of content in those thematic sheets that you have there. have they all been produced by Consortium National de Formation en Santé? Or like, let's say if I were somebody in the field and I have a piece of information that is very useful in my area, could I contact anyone from Consortium and have it added to your website?
Oh, that's a wonderful question. The thematic sheets have been written by the consortium with the help of Manon Cormier from Université de Moncton. And using the content from La Boîte à Outils, using new research, so we wrote the new content. Now, the Carrefour wants to be want to have everybody contribute. We need our researchers, our teachers to contribute. So we have in the resources, we add everything that our partners send us. But this needs to be improved. I mean, all the time, we want to keep this website very dynamic. So yes, if someone has resources to share, it is very, very, very welcome. And this makes me think of something I did not show you. So thank you for your questions, because I want to show you that in the join us, to use please the email, because we're all right now in teletravail, we're working from home. So the best way to reach us would not be by telephone, not those numbers, but using the email or this to send us a message. And there is also a formulaire de rétroaction will be translated to give us feedback. There will be another bigger survey out to really assess the whole, but please use those tools here to talk to us, to tell us what you would like to see, what you would need to in your work. So I wanted to show that before. Okay, when I was on the main page. So see, when to add to your question, as well on the main page, you have access to the research, to all the resources. So I can type offre active, and everything comes up about offre active, active offer. And this is where we would add resources that you would have, that people would have. We would probably add it there or create a new thematic sheet depending on what the content is. So yes, please, this is really what the Carrefour is about, is working with our research groups, working with anybody involved in training in the active offer.
This is great, thank you.
Okay, this is, now I don't know, I want to make sure I've shown you everything. Or maybe I should show you, if you haven't been, there's a little band in the taking part, just to demystify and understand a little bit more. There are some myths about French people. And here we're saying, well, if they want French services, they can just ask. But here we explain that services in French have not existed for so long that people don't even think of asking. So this is why we have to really say not only hello, bonjour, but which is a good start, but as well respect the language, ask what language they would prefer to use, and either speak their language or get someone who can. And then another thing is about Francophones being bilingual. And we see that, yes, Francophones, a lot of them are bilingual, not everybody, but even those who are, will have problems explaining a problem. And if you look at the describing symptoms, a little, what can happen in a situation where, yes, you can work or in French or speak French with friends, English with friends, but then try to describe symptom, pain, then it becomes more difficult. Little anecdote. My sister had a call, was visiting my mom, who was like 95 years old, and the doctor called to because it was some kind of emergency. He called in the night, and my sister was trying to explain that my mother had lumps on her arm, but she couldn't remember the word for a lump. So she says the opposite of a hole. I mean, it was, we thought it was very funny. We still tease her a little bit about it, but it was very tragic at that time for her not to be able to explain what was really happening to my mom. I'm not sure that the doctor understood. But so this is an example of being bilingual, but sometimes describing does not happen. And then about interpreters, professional, of course, interpreters are good, but then if it's a family member, then it becomes another story. And as well for just a colleague who's bilingual, if you ask someone like on the spur of the moment to translate something, it's not that easy to translate, even though we're bilingual. We're not translators, and that is the whole career. It's something you learn to do with many years of university. So it's not fair to ask a colleague to translate. So this is the Carrefour. And like I said, this year is about doing the survey, seeing, how people are using it. And we want to add, we've started adding, we have new videos now, but we want to keep, this was our commitment when we created Le Carrefour, was to keep it dynamic, to keep updating all the time. So this is what we want to do this year, and then add on. So I will welcome any questions, any comment, anything that comes to your mind now as you see the tool. Tell me if it can be useful to you. Tell me what you would like to see, what would be useful and is not there, what is there and is very useful. So any comment would be very appreciated. Any questions?
Yes, and talking about questions, we do already have a question in the Q&A box by Georges. And Georges was asking, are these, what you're presenting us, are these assessment tools or tools that are used to implement something?
Okay, no, they're not assessment tools. They really are, it's really training material. Teachers, trainers can use this material to create lessons. And as well, like the English tab is also there because our French teachers may want to talk about active offer in English. So we thought that the English tab is as well for that. Sometimes to a manager in a health institution, to a supervisor, work placement supervisor who doesn't speak French, to really give the English vocabulary as well, to explain what active offer is. So that's what it is. No, there's no assessment here. It could be created from the material there, but so far there is no assessment.
Thank you. No, so for you participants who are online at this time, feel free to either use the Q&A box or use the participant button at the bottom of your screen to raise your hand and voice your question directly to our panelist. Or like I said, if you prefer to put your question in writing, you can do so either by using the Q&A or the chat box at the bottom of your screen. But we do welcome all of your input at this time. There are a lot of under team directory. We can really use that to sort of find what it is we're looking for, correct? As opposed to resources are listed in different ways. Is this how it is, Elisa?
The teams, you mean, let me go back to the main. so the themes are accessible once you enter one of the doors. And this is where you find the different themes. Now, as well, once you enter, themes are always accessible on the left. You can move from one theme to the next without having to go back to the main page. So once you're they're always available. Resources, once you're in a theme, the resources available are linked to this theme.
Correct.
To have access to everything, then you would be on Comprendre.
All right.
And there you have access to everything.
Okay.
Okay.
Thank you. We do have one question from Sheila. So
Hello.
we will open your mic, Sheila. You can go ahead.
Thank you so much. I might have missed this, but what I see is that most of the website is in French, and then there's the English part is taking part. Is that the only part that's translated? Because I have the website open and I can't see the little English button that I see. I did see it a minute ago on yours.
Okay. The only place where you find English content is in taking part, but everything is there. Okay. All the thematic sheets, all the content has been translated and is in this last tab, taking part. You have access to all the thematic sheets. All the resources are not always the French resources are not there. Maybe it's something we should think about and put everything together. Maybe this is something you could react on if even in the English tab, we should make all resources French as well available here. Maybe that because maybe that would be a good idea.
Yeah, lots of translation then, right? For your
the French tools, we would not translate them, but we would make them at least available.
Okay.
Yeah.
Okay, thank you.
Okay.
Yeah. Thank you for your question, Sheila. And in fact, when Elisa started presenting her the website, I thought, my gosh, in English, it's so much easier because you just have to click one button and then it opens up taking part and everything is there. Like you don't have to go from one thing to the other. I thought it was easier this way.
And I think most people would either, if you're French, you would, go into Comprendre and you have everything, go into taking part and you have everything. But then if you're a teacher, this is where you will find training tools, training material, okay? And participate, maybe this needs to be clarified, added more, because it is, more aimed at how does active offer, how does it become real once you're at work, okay? And so, yes, maybe if you have feedback on this tab, that would be great as well to, I don't know if we have anybody from health institution online with us. Would be fun to know a little bit where people are from. I don't know. I see in French, I know a lot of people now.
We have quite a good variety. We've got people from the hospital environment. We've got people online who are from health authorities as well.
Okay.
And so we have quite a good variety of both professionals and in the field and people who are in the health authority. And as well, we do have a few people from university. So we have a good, and from the health network as well. So we have a good variety. But for those people who are not in the training field per se, in the university or college environment, how do you see this Carrefour being useful to you in the field? Or like I was looking at when you clicked on taking part and then you open up the thematic sheets, I was thinking, my gosh, it would be nice, in fact, to print some of these and post them like in a waiting room, or that was just one way I was thinking of in terms of you create an environment where it's people feel safe and secure asking for services in French. So I don't know if that is something that you people who are online at this time, do you see yourself or your organization doing something like that? Or is this something that is not being used? Or even in the television or the screens that display information when you enter a health facility? Like I could see some of those things appearing on those screen and being becoming a tool to welcome people who are speaking French to ask for services in French. So I'm just sort of feeling here to see if that would be something that you think your organization could do. So the ball is in your field. Participants online, feel free to raise your hand or contribute if you feel like it.
I can see I've opened the sheet on the impact of language barriers, and I can see what you're saying right now, Nathalie, sorry, that like one page, like it doesn't have to be the whole thing, but different pages could be, yes, affiché, shown either in a waiting room or on the TVs, where it's very short, but it goes to, it explains very, in a few words, the impact of language barriers, make people aware of what it is.
And it seems to me that it's fairly plain language as well. Yes, Sheila, go ahead, please.
The active offer, when somebody says hello, bonjour, right? It's but what happens if somebody then starts, that person knows French but is not completely bilingual, and somebody starts speaking, fluently, rapidly in French to them? Like, are there is there guidance? Because that person who greets the person may not be the person giving the care in French.
Yeah, I think of course not everybody is bilingual to the same level. Some professionals might be bilingual, but yes, it can be not to the point of explaining a difficult surgery or something. But right away, I think the being open to the fact that this person is French is already, I think, creating a better relationship. And it may mean to offer interpretation services if they are available. It may mean for people that are not, for professionals who are not, all at ease, to have some written material in French.
So do you have that? Like, is there something that says, au moment, je vais chercher pour une personne bilingue, something like that? Like, is there, do you have something like that? Like the cheat sheet or something?
Yeah, not that we've created, but there are links to different tools, because those tools do exist. There's no point in repeating them. They do exist. Many establishment has them. So yes, these things exist. Well, for us, it'll be more a matter of inviting people to get some some translation. And there's so many things available online as well now that you can quickly have access. So sometimes, it's just a matter of opening up to, I understand, that I know I don't speak the same language as you. Let's try to connect the best way. Sometimes that could be enough to the other person would be more at ease to be there. Now, if really there might have to be calling upon another colleague with the same knowledge to offer the service, there are ways of doing it.
Thank you.
Thank you. So then really there are a lot of active offer training for different categories. Either you're a student at the university or college, there are different type of training on active offer available. So through your Carrefour, Elisa, can somebody click on the link and access those online training for active offer? Whether you be in the field or in training?
Yes, we do, and we will keep adding. And something else that is coming up now that I should say is that we also have now a programme d'attestation. So there is now an exam that will confirm that someone has all the competencies to use active offer, understands everything about the risks of not having services in your language. So this will be on our website as well. And so that's something new that will be there. There's a training and an exam that brings students to in certification in active offer. So those students would have really gone through a lot of training and commitment to active offer. So this will be on the website soon.
This is a great addition because quite often people like health professionals are required to do continuing education. So the fact that there is a certification or something official after you've completed the training is awesome. Yes, this is a great addition.
Yeah, the CNFS had been working on this for quite a long time. Finally, it's there and will be available very, very shortly. Okay.
All right. So we will welcome, we still have a few more minutes to go, so we will welcome any extra comments or extra suggestions to make the website of the Carrefour even more user-friendly, or so feel free to comment, suggest, add, share some of your experiences that you've done, like was just mentioned. Once you've opened up to say yes, you can have. I see that you speak. You're more comfortable speaking French. There are different strategies that can be put to place so to help this person access services in French. And like that, it's all about creating a safe and secure environment so that Francophone speakers can feel welcome in your establishment.
Yeah, I want to show you again, just to make sure that everybody has seen it from the main page of the Carrefour. If you have any comments, please, it might be easier for you to use this link, nous joindre, and send us a message using this, or there's our email addresses there, CNFS, we will get your message, or again, the evaluation sheet, which is in French. It will be there in English as well. So please, if this is more comfortable, but do connect with us, let us know what you think.
And Elisa, I guess there are the majority of your clients or users of the Carrefour de l'offre active are coming from training establishments, whether they be community colleges or university. But have you had any requests from hospital as well, or health centers to use the Carrefour?
I think right now it's mainly our teaching colleges and universities, but to answer very honestly, I would have to look into the what is called the surveys that are the website, l'analytique. But that's a good question that we will look into. Of course, the website is mainly for training, is aimed at our institutions. But I mean, the more people who use it, the better this will become. I mean, they are students, but they are soon to be health professionals. So the two fields do come together.
Maybe to me, this seems fairly user-friendly at this time. I was wondering, any one of you online this time would like to share or maybe suggest ways that to make this website even more user-friendly, referring to the first comment that was used about taking part, saying that that seemed like it was the only one section that was offered in English, and am I losing on information since there are so many more tabs that are in French? So that might that might be something that I have in mind as well. Elisa, you mentioned earlier that you can do a search in French, but can we do just the same in English as well? Could we do a search as well, just using words in English, and that would produce a result?
Yeah, it's not, the feature is not complete, but it will be exactly the same thing. Right now, we need to add some, we need to, everything is in place. It's not yet functioning as well as the French, so but it will be. This is one thing that will be improved this year. When we launched at first, we did the French side with all the details and had everything translated, but now this year is really the main thing we want to do, is to improve the English tab and add a lot of English content as well. Because I think we need to reach out to our Anglophone colleagues, friends, for this to work. I mean, it cannot just be the French people who understand what it is. So we really have to reach out, and we want to do it this year.
Thank you. I have another question, but before I voice that last question, I just want to inform all that there will be a poll appearing on your screen, and this is just to help us evaluate the webinar that was presented today. So we welcome you to answer the question. There are just a few questions. If you, we would like you to scroll down to the very last question, and you can do so by just touching on that gray line on the right side of yours, on the window there. And after you've answered all 4 or 5 questions, just press submit, and that will allow us to provide some feedbacks to our panelists today, Mrs. Elisa Beaulieu. Elisa, I have one last question for you. That is maybe more on the personal side, but I see that there has been a lot of work put into creating that Carrefour. What are you most proud of when you look at the Carrefour today?
Oh, I think I'm happy that that it will be a dynamic website where we can keep adding and adding, that we don't think that it's done, there it is, use it. I think this is what was the most important when we started, was that it would be a website that can be updated and added to all the time. And this is what we are able to do. I think this is what I really like. And so far we have content, we've started, but now we can add, and it's on our work plan for every year now. There is time and money put aside for updating and adding to the Carrefour. I would say this is the most important. Research are done, like, all the time, so we need to take them into consideration. So now, yeah, I think this is what I'm the most proud of. Yes.
Right on. And we do have one suggestion to make the website even more user-friendly. Lise is mentioning, I think that for the English tab to reach the right people, there would need to be a sharing of a direct link to it. So that's something to think of, maybe.
I'm not sure if I understand.
So maybe Lise could comment a little bit more, but she's suggesting the sharing of a direct link.
Oh, okay, I see what you mean. Maybe could be right now the link brings us to the whole Carrefour. So if you're on a website, if they put the link, it brings you. Does Lise mean to that there would be a link that comes directly to taking part? Is that?
Hi, can you hear me?
Yes.
Okay. Thank you. Yeah, that's what I meant. I meant that without a direct link, the way that it is now, I don't know what your plans are in the future. I feel I wouldn't know how to do necessarily the promotion, or because once you get on the site, you see everything in French.
Yes.
And you might see the tab taking part, but you may not, or you may not see the relevance, because the whole la mise en contexte n'est pas accessible. So the
yes, I see and if we would, like right now, the interface is only in French. You cannot go to an English interface. Maybe just even having that would be great, so that if you, as you enter, you could right away choose English, and the whole website, like right away, would be in English, and
That's
maybe
right.
so that the on the landing page we would invite right away people to, if you wish to access the English content, please, and put a button there, click here for English content, or
Yeah, I think that might be
it's
helpful. Yeah.
okay. Yes, good comment. Mhm.
This is a great suggestion, Lee.
Yes, really
you-
good. Yeah.
Yeah, thank you very much, Elisa Micheline Beaulieu, for this presentation today. We're running out of time now, but I wanted to thank you for your presentation. And as well, I want to thank all participants online today for their contribution and sharing of comments and reactions. Thank you muchly, and all the best to this Carrefour de l'offre active.
Thank you. Thank you very much for giving me a chance to showing our tool, showing off our Carrefour. Thank you very much.
Have a nice
Thank
day.
you all for being there. Very, very good to see so many people.
All right. Bye-bye.
Okay, bye.